much for all of our speakers today. You did fabulous, and you raised a lot of emotion here today. And I think I've probably expressed the most emotion here today than I have on all of my interviews. But don't worry, I won't drop the F-bomb. Unlike someone else. Because instead, I'm going to harness my energy, my emotions, and put this into our calls for action, for positive change that we all need and deserve. So I hope that I'll be able to see all of you out at our rally on May 19th from 11 a.m. to 1 p.m., standing shoulder to shoulder with me and my group, all the medical professionals that will be there, all the other residents and citizens of British Columbia that will be there, and let us show them. Let us show them that this is not acceptable, and we are not going to sit around and wait. We need immediate action. Thank you all very much for coming today. So we'd just like to open it up now that if there are any questions, and we'll kind of try to direct to the correct individual that might be able to provide you with an answer. So at the back.
Yes, my name is Laura Campbell. I just come to, I've been in Victoria just over 1 year. We moved here April 6th of last year, and my husband and I were positively shocked to discover you couldn't find a family doctor. We had a wonderful doctor in Calgary. Her name is Elizabeth Thompson, for those of you who might be thinking about going back. She's absolutely outstanding. She found the bonus area clinic there, and she was far and fantastic. What I don't comprehend is, and maybe some of you who were in oil and gas can tell me this, but Alberta is right beside BC. They have a wonderful system. You don't have to go to the United States. Well, that would be a bad question to go to. We don't have to go anywhere else, for an example. We've got one right next door. Why is the BC healthcare system not a replicate of our excellent Alberta system? And is it because Alberta has oil and gas? We pay so many taxes here that, we pay all these taxes. Where else is this money going to? I don't comprehend. Now, I just understand that Premier Hogan is recovering from people. Does he have a family doctor? Does he have access to all the specialists? Somehow I suspect he does. And so I don't understand where the where is the breakdown? How is this even going to allow this to happen?
Yeah. So just to repeat for our online viewers, I'll try to recap your question quickly, which was that we do have our neighboring province, Alberta, that has, in comparison, quite a thriving healthcare system. And so why is it that British Columbia cannot replicate some of what Alberta has succeeded at? And also the question raised, what was the other second part? That's the question? Okay.
My friends back home tell me if you drive down Sarcee Trail, there are doctors advertising that they want more patients. They're looking for patients.
So there are doctors in Alberta that are advertising for patients. It's not that difficult to find. What is the question?
Friends in the Okanagan, they shut their Alberta Health Plan. They drive back to Edmonton, stay for 2 weeks, get all this testing and everything done, drive back to the Okanagan. I don't even think that's legal, but that's where they can get all their help because they can't find anybody. It's mind-blowing.
It is.
So I guess the question is, why don't we have an Alberta system here in BC when they're just next door?
Good point.
I think we need a politician.
So I guess I will take that question, and based on the research I've done, as well as having been an Alberta resident myself within the last decade, I do concur that the services we were receiving as a family in Alberta were far exceeding what we're able to receive here in British Columbia. And from what we have heard, This goes back to much of the issue that the BC government does not collaborate appropriately with the health associations as well as the medical professionals in the same way that they have done in Alberta to create, as Lana suggested, effective working primary care networks. The other thing is that BC has held several conventions where they have even brought in individuals from Alberta to gather information, gather expertise, for example, on what's called EMR. So that's the electronic system that's used for collecting all of our data. And they brought in people from Alberta, as Alberta has what's called the Netcare system that works very well, very consistently. Held a convention, shared information, found out how they could implement it in BC. And the BC government decided instead to hand out 6 different options that the province of British Columbia within their health authorities could choose to implement. So I don't have the exact answer to your question. I have the same question as you. Why must we continue to reinvent the wheel in British Columbia? And why can our government not take some tried and true successes and implement them here? Ontario has several of them themselves.
It would be very easy to do. We have a model right next door.
Is there another question? Sorry, just behind you there.
Stand up, please.
Number one, with the doctors, I understand from various people, politicians and so on that talk about this, that one of the problems with the doctors is that they don't look at that colleges, physicians and surgeons is reluctant to license people from abroad or nurses who have been trained in other countries, and they have to come here and run through very expensive hoops in order to get licensed and able to practice. And secondly, I would like to know what your organisation, what they have in mind in terms of actual approaching people. I know you're very young, and your organisation is very young, and I know that you haven't had time to do a lot except gather support. So I'm not criticising you. It's just that what do you have in mind in terms of approaching politicians before the next election and this sort of thing? Because Mr. Dick seems to be well-intentioned and does work hard. I think he has worked hard in COVID, especially, but I think he's perhaps, he only has 24 hours a day as well. So it's not all criticism. I think you have to give some to people. But I just wondered what you had in mind in terms of action to the people who have the opportunity to do something. And Horgan was on CBC this morning and said it's all because they're not getting transfer payments and so on. So what's happening about that?
So about 3 parts to the question. So the first one being regarding access for international physicians and nurses to come and practice within British Columbia more easily. So again, I will let one of my colleagues here step up if they'd like to provide more expertise on the actual field. But the one thing that we do always kind of want to highlight for people is we're showing you and describing today a system that is not functioning, a system that is not providing. And so to suggest that one of our solutions might be to bring in foreign doctors and foreign nurses, it begs to question whether they would even want to come here, considering they would face the same struggles as the nurses and doctors that are currently working in this system. So once again, adding more bodies, we definitely will need more bodies. There are retiring physicians. There's no doubt about that, and we fully support easing international processes to get more people into Canada. But this crisis right now won't be solved with that, because if we don't create a better base structure to support the individuals that we want to allow to come into our country, we'll be no further ahead. They will just simply move off to other provinces, or they will choose the more lucrative positions as well, and it won't help support our family physician need. Is there anything to add to that? And sorry, there was a second part though. Yep. And now I just forgot. Oh, right. So yeah, what are our efforts being made with politicians? So we have met with several MLAs from every party. And the only individuals we haven't met with yet is Premier Horgan, who happens to actually be the MLA for my district, and I have made several requests to meet with him. So I'm eagerly anticipating a response from him one of these days that he will come and meet with me as my MLA and as my Premier, and I think that is a conversation that should happen sooner rather than later. As for Adrian Dix, I have not heard anything from him either. He has been CC'd on all of our communication, but to this point we have only received some of the emails that some of you have already as well. So we do continue to try to open a door in communication with MLAs and with the Premier and with the Health Ministry, and we are an open door. We're happy to talk anytime.
I'm Dr. Koga. I'm a retired pediatrician.